How long is the average stay for autologous stem cell transplant?
So the first question about how long you can expect to be in the hospital or have to be close to a hospital for the transplant. So on average, we tell our patients that for most it takes about like 4 weeks for them to kind of fully recover from the transplant, at least the initial part, and then be able to go home, to recover at home and then come back and see us in the clinic. Um, Typically, what factors come into play is if you're not requiring blood transfusions or if your white cells have come up. So we use a term known as engraftment or stem cell engraftment, which is the stem cells that we have given to you are able to go inside your bone marrow and start making healthy blood back up again. And so during that period, which normally takes about 2 to 3 weeks, your blood counts can be extremely low, so you can require blood transfusions, you can require platelet transfusions. You have a very weak immune system, so you're at a very high risk of infection. So you will be on certain antibiotics and certain medications to protect you from those infections. And typically what happens is after about 2 to 3 weeks, we start seeing the bone marrow start making healthy blood back up again. And so your platelets start getting better, your hemoglobin, your red cells start getting better, and your white count starts coming up. So once we have reached a point where we don't think you require blood transfusions and your bone marrow has engrafted and your white cells have come up adequately, that you're not at very high risk of infections, is that when we can basically let you go home and recover at home from that period.
So how long do people need to stay around for a transplant? Well, at our center, after the stem cells go in, we have people stay on the transplant team, which is a separate team from like my clinic. So I'm a multiple myeloma clinician. I see patients in sort of continuity, but we have a separate team that does the transplants. And when patients are on that team, from the time of the start of the stem cells going in to going home or leaving back to where they're from, it's usually about a month. So about 2 to 3 weeks for engraftment and then another week for monitoring for any other toxicities. So in terms of the stay in the hospital, that really depends. Often people will be able to leave once if they're in for a neutropenic fever, once their neutrophils are normal and there's no further sign of infection. If it's nausea, the nausea has to be controlled. But often this coincides with their engrafting, so usually around day 14 to day 21. So it depends in terms of the hospitalization stay. It really depends on how someone does.
What is engraftment? How will my doctor know if I am engrafted?
Well, the best analogy I have is, planting, the seeds in a field, and we're waiting to see signs that we're seeing, evidence that things are growing. It's the same thing with stem cells. We want to see the stem cells have taken. It's very uncommon to not see an engraftment. Maybe with other types of transplants that can happen with allogeneic transplants or cord transplants, but with autologous or your own stem cells, the odds of not engrafting are very, very low. So almost everyone engrafts, and we look at the neutrophils, the fighter white blood cells, and the platelets, those cells that help your body clot blood. And when they get above a certain threshold, and it varies from center by center, we would say that someone's engrafted. Typically, we want to see the neutrophils above 1,000 and the platelets above 50,000. But those are kind of rough guidelines. But that's usually what we want. We want to see that things are heading in the right direction.